Folks in rural communities often don't have a hospital or surgery center anywhere nearby, but a Michigan company is now looking into using robots to complete those surgeries remotely. Kyle Mitchell tells us how it would work.
Spectrum Health researchers have been able to operate robotic arms like this one from up to 3,000 miles away and hope to revolutionize care.
The physician would sit, usually in the corner of this same procedural room and use a series of controls to manipulate this robotic arm.
Dr. Ryan Mader, the section chief for interventional cardiology, says they've proven it's possible to remotely control the robot from great distances.
And the research that we've done in this telerobotic space over the past 8 years, we've demonstrated that you can control this robotic arm from afar to conceivably do a procedure to fix somebody's coronary arteries or to fix something in their brain.
The goal of the program is to bring more specialized care to rural areas and perform procedures earlier to avoid a transfer.
Right now in the United States, there's disparity in healthcare. That patients who live in more rural areas that develop conditions like heart attacks and strokes, it's been shown that those patients don't get the same treatment.
Doctors are training on mannequins remotely because of advances in technology.
Our networks are exceptionally fast, and so the robotic signals that have to be transmitted from the controls to the robotic arm to do a robotic procedure over distance.
Many rural hospitals don't have specialists like Dr. Mader and have to treat heart attacks with medications before transferring a patient to a bigger city.
If we were able to develop telerobotics to treat those patients immediately without the need for having to transfer them, then conceivably it might reduce the risk of death, it might reduce the size of the heart attack, it might reduce the risk of subsequent congestive heart failure.
In Grand Rapids, Kyle Mitchell,